Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Tuesday, March 14th, 2023. Here we are on a Tuesday. Today is part 2 of Brianna's birth story, which is being redropped as part of our mini-series on GI issues, what we're calling Gut Check. If you didn't hear part 1 from yesterday, make sure to listen to that one first. Today, Brianna's going to talk about her postpartum course, and we also have a long conversation about mental health and how important it is. Next week, Dr. Asher Kornbluth is going to join me to talk about Crohn's and ulcerative colitis. That was a real treat for me. Asher's awesome. Reminder for everyone listening on Apple or Spotify, please do rate us. And if you can send in some comments, we would love it. Thank you. All right. Thanks for listening. Have a great week. We'll see you on Monday. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. I'm just curious, did that experience, both the good, the bad, the ugly, all that, did that change your OCD as related to medical care, the medical anxiety, the OCD regarding medicine? Do you feel like it's better, like it's worse? I'm just curious.
I do think it's better. My best friend, she's my best friend of like 18 years and 20 years, I guess. She told me, she's like, I can't believe you go to the doctor now. Like, I'll willingly make a doctor's appointment. But I'm also fortunate that I still go to my OB. Like, if I need anything with my medication adjusted, I go to her. I haven't necessarily reached out to a primary care physician yet, but I do think it helped a lot in that I now know. I think I was just really scared that all doctors were I'd had some bad experience with doctors when I was a little bit younger, and now I know that they're really great doctors who are patient and aren't going to make me feel dumb or anything like that. So I think it did help a lot. She probably helped a lot. Like, getting her as my OB helped, because I think now I see myself being able to go to the doctor for things now that that's done. And also I feel like I survived that. Like, I can do anything. Like, that's what it feels like. It feels like I basically lived my worst fears.
Yeah.
And I lived. So I feel like what's another doctor's appointment now? It's kind of like my thought process.
It's such an important topic and such an important lesson because, you're describing a situation where, here you are, you're a good person, you're a conscientious person, you're pregnant, you're not well, but you just aren't able to sort of go to the doctor or navigate doctor's appointments the same way as, let's say, everyone else would. And it's because of it's a mental health condition. You have OCD, you have anxiety. These are real. And you're describing a situation where some people sort of understand that and are able to work with you and, to get you through it and to help you. And you feel very, you have a connection to them, you feel grateful to them, they're caring for you, and other people who can't. And definitely there's people who are listening who are thinking like, well, oh my God, like, of course it's so hard to take care of her, but they would never say this. Yeah, but they would never say the same thing if you said, I'm blind, right?
Yeah.
And I was born with, I can't see. And so when I go to the doctors, it's very difficult because I can't see the blood pressure cuff. I can't see the signs. I have to have someone help me through. And they said, and no one would say, oh, it's so hard to take care of her. Like, oh, they would say, oh my God, like, I feel horrible. It's like, she, it's hard. She can't see. Like, we have to help her. And I think that this is like part of the conversation about what it means to have, an understanding of mental health. It's not just, oh, we should like be kind to people who have, mental health conditions. It's that it presents logistical challenges to sort of typical things. And just like we would accommodate someone who can't see or can't hear or is in a wheelchair or whatever it is, we have to understand that you don't wish this upon yourself. You're not trying to be anxious or trying to have OCD. You just have it. Like, it's what are you supposed to do? Like, you do your best. And it's up to us to try to accommodate and try to do the best we can to help you navigate the system under those circumstances.
And I tell her every time I see her, I told her I was doing this podcast too. And she was like, that's so great. It'll be very healing for you. And, I was like, I just can't wait to sing your praises too, because she just was, I told her, I was like, I don't know that I'd be here if you weren't here to help me, because I don't know, like, I've never felt lower than you. It's a special kind of like, I don't know, like hell, I guess, to be so sick and not be able to take care of yourself. And you just feel like, I mean, it really feels like you already deal with your anxiety, but then you're so sick every day that it's like, you feel like it's never going to get better. And then I'm thinking, oh my gosh, my baby's probably really sad because I'm really sad, and I'm just feeling so low. But she was there constantly for me, so patient, so kind, never made me feel bad. And I mean, she would tell me all the time, it's not your fault. Like, it's not your fault. You're scared. Like, you don't have to apologize. Because I'd always be like, I'm crazy. I know I'm just crazy. I know it's so silly. It's so stupid. And never once did she agree with that, obviously. And so, I mean, it is important because I know, from reading other forums and stuff that I'm not the only person who deals with this kind of like specific, anxiety. I don't think it's as prominent as other types, but I know that I'm not the only person. And so, I hope people know that you're not stupid, and hopefully they can find doctors that don't make them feel that way either, because that was so important, to, I really don't know if I would have made it if I would have had somebody who maybe didn't believe me or who made me feel like silly. And so, I mean, it's real. It's debilitating. It can be debilitating. I've had to quit jobs before, it's debilitating what it does to your life. So, to even be a little bit better now is a big deal to me.
Yeah. Do you want to give her a shout out by name?
Yes, her name is Dr. Katie Shannon, and she works at Just for Women Health in Jeffersonville, Indiana. She is wonderful. She is young, and so I know a lot of people were like, "Oh, you picked such a young doctor." I think she's probably like 35 or so. But she was great. It was such a great experience that I said I would never have another baby after this, but she makes me want to consider it because I feel like we could do it again together.
Wow. Dr. Katie Shannon, strong work. Really. It's not easy. But again, I think that it's all a part of this idea that we doctors, we in healthcare, we in society, all of us, we have to really accept the fact that mental illness is something that's real, and it's not the person's fault that they have it, and it's not something they're trying to do. And we have to be reasonable and accommodating and caring and kind, just like we would for someone with any other health struggle. We don't get mad at people for having diabetes. We don't get mad at people for having cancer. Like, it's not their fault, right? It's just something that is. And if someone has anxiety or OCD, that's what they have. That's who they are. I mean, every single day. I mean, when you say you're not alone, you are not alone. Every single day, I have more than one patient tell me, I am so anxious. I'm so nervous. And some of them are just saying that like as a symptom, like, they don't have a disorder, but they're just worried. But many of them have clinical anxiety. They're on medication, whatever it is, whether it's as bad as you, not as bad as you. And I tell them, I say, we specialize in anxiety. Like, everyone out there has anxiety. It's just a matter of how much in the waiting room, right? And in some people it's debilitating and other people it's not, but it's real. And, making people feel bad because of it, A, it's just mean, it's cruel. And B, it's completely unhelpful. It's not productive. Like, look at how, you were able to sort of get through a healthy pregnancy because your doctor was understanding, and it made it better for you. It actually made it healthier for you. I mean, I feel very strongly about this. And I just think that what you're describing is so important, and to hear it from your end. And I mean, listen, you're lovely. We've never met, right? You're lovely. You're normal. You speak, wonderfully. You're thoughtful. And you're saying, I have a severe disorder of anxiety and OCD. And that's who you are.
Yeah, it's a very prominent. I mean, I think in the past few years, especially, I've been very vocal in general about it, because I do feel really strongly that it's not talked about enough, and that people kind of have a very specific idea of the type of person who has OCD or the type of person who has, depression or anxiety. And I'm like, maybe you didn't know this about me, but this is something that rules my life a lot of the time, and thankfully now I'm medicated and I feel a lot better. But, I still have bouts of it, especially having like an infant. I get a little anxious about him. And by a little, I mean a lot all the time. I get anxious over if he's sleeping enough. I get anxious over if he's eating enough, if he has reflux, if he, I mean, it's still there. But because she was proactive, she told me you're very susceptible to postpartum depression. You're probably going to want to start medication now. And she did that. And so now I'm on that, and it helps a lot. I mean, I can't imagine what I would be like if I didn't have it. It feels like a lot of times maybe I just have regular people anxiety now, like new mom anxiety, and not like this intense, gonna lose it all the time anxiety. And so, but I appreciate you saying that. And I've, like I said, I've listened to all the episodes, and everybody always sings your praises about how great you are and patient you are. And so I think that's wonderful. And that's kind of why I wanted to do this, tell my story here, because I mean, I was like, who better? Like if somebody else says out there, like, my doctor who is understanding and kind, and I just really appreciate it. I appreciate what you do, even though obviously we've never met. But
Yeah. No, I'm sure I could be better at it. I mean, obviously there's always room for improvement, but I've said many times, it's one of the things I've learned the most about in my career, and that I feel that like where I am now compared to where I was, 10, 15 years ago, in terms of like my, hand-eye skill levels in surgical, all right, I'm a little bit better. In terms of my knowledge base and experience, all right, I'm a little bit better. But in terms of understanding mental illness and, helping people with and working with people who have mental illness, it's just light years. I've learned so much more in practice than I ever did in training. And I just think it's one of these things that you don't really understand until you're doing it and you're working with people, and you have to it's just the reality, and it's important. You said that you were still working through the trauma of your birth. What was it that was traumatic? Was it going through sort of like facing the anxiety you were up against, or was it anything in particular that you maybe could have gone back and changed that would have made it less traumatic, you think?
I think it's kind of, so I have this, like in my brain in general, I try not to, I kind of I don't have a lot of expectations. I try not to set a lot of expectations, and that's translated kind of into motherhood too, which is another story. But I've tried not to set a lot of expectations for things. So I kind of, was very, oh, whatever happens, happens. But my biggest fear, was having to have a C-section. That's my biggest fear. It was my biggest fear. I didn't want to have surgery. I've never had surgery. And, so then it was like, when they told me I had to have that, I was like, oh my God, this is like it just, knowing I had to do it was extremely traumatic and hard for me to deal with. But I got over it. Once the baby was here, I was fine. They told me everything's good. I didn't have cancer.
Mm-hmm.
What really, I think, was traumatic was the postpartum, the preeclampsia with a doctor that wasn't as patient and kind, obviously. And that way, I just think we didn't mesh. It wasn't that she was a bad person. It was just that we weren't good together. And that's what my doctor had said. She apologized the next day, like 2 days later, profusely. She's like, I think, obviously they just didn't know your situation. And like, I wish I could have been there. I would have done anything to have been there. And I think that, my husband having to leave and I'm all alone with my baby. I had never even changed a diaper until I had an infant, so I didn't know what I was doing. I was terrified. Part of what was happening in the hospital when I was there on the mag drip was that they would, it kind of felt, I don't know, the best way I can think of to describe it is the way my best friend described it while she was sitting there, is it was kind of like, a horse, when they would dangle the carrot in front of the horse to like make it do things, and then they would pull it away, kind of like a cruel joke. It kind of felt like that, because they would come in and say, you're going to go home today if we can get your blood pressures down. Now, if we can get them, if you can calm down and if you can just breathe, then you can go home. And so it felt like a game almost that I couldn't win. And so I dealt with a lot of like, I think I deal with a little bit of PTSD.
Yeah. Well, it's also making you feel guilty, like it's your fault. Your blood pressure's high. It's the same thing. Like if only you could get your blood pressure to go down. Like, how the hell am I supposed to do that?
And so they would like flip me on my side, and they'd be like, "No, don't watch anything. Don't listen to anything intense on your podcast,
dear.
and just close your eyes. You got." And then they'd come in and be like, "See what happens when you're calm? Your blood pressure went down." And I'd be like, "Okay, well, let me see if I can do it again." And I'd be like sobbing. And then at the end of that day, they'd be like, "Sorry, it's still going up. You gotta stay." And I was like, "Oh no." And that's when I was like, "I'm going home. I don't care." I literally was like, "I don't care if I stroke out in the parking lot. I'm leaving. Get me out of this bed. I'm going home." And then eventually they did manage to get it down. But yeah, I think that's kind of where it came from. It was just like a really mean game that obviously they weren't trying to be mean, but it was just really hard on me. It felt like I was never going to get to go home, because I'm also a worst case scenario person. My anxiety makes me like that. And so I was like, oh my God, I'm just going to have to be in the hospital forever. And this is just like, I'm not going to get to go home with my baby, and I'm not going to get to see my husband. And, I want to be in my own bed. And it was very traumatic. And so I'm still kind of working through all of that as a whole. I think also I'm really scared to throw up now because,
Mm,
I was so sick. So anytime I get a little bit nauseous, I'm really scared that I'm going to throw up. I don't want to throw
yeah.
up. I don't want to get sick again. And so the whole thing was kind of traumatic, honestly, the whole situation, the whole 8 months, I guess. But I'm trying. I'm working through it. Like I said, I see my doctor often. She's helpful. I can message her anytime and she's really great, but I'm still kind of working through all of that, that whole situation, that little situation, no big
Yeah,
thing.
that whole year-long situation. I think when you're in the hospital and you're that, I think that sort of the more effective messaging is, listen, you have anxiety, have as much anxiety as you want. That's okay. We'll just make sure your blood pressure's not so high that it's going to harm you. And
Yeah.
ultimately, it's just, what are you going to do? Tell them, like, don't, like you said, don't worry, don't be anxious. Like, that doesn't work. Like, when has that ever worked in the history of mankind, right? Telling someone who's anxious,
I'm
don't be
trying
anxious, right?
so
So you just say,
hard.
like, I would say the opposite. You're like, be anxious. It's fine. Like, you could be anxious. Be as anxious as you want. It's okay. You're allowed to be anxious. We'll just, you take care of your anxiety. Let it roll. We'll take care of your blood pressure. Make sure you're safe, and it's all going to get better with time. And I think ultimately, you sort of, you've been living this your whole life. You know how to self-soothe and sort of get yourself back into
Exactly. Yeah.
your routine. And as long as you know, like, all right, I'm not going to die because of this. All right, then it'll take some
Yeah,
time and you'll
that's
get
really all
better.
I wanted to hear.
Yeah.
I was just looking for, like, hey, you're not doing anything wrong
Yeah.
and you're not going to, like, we're going to make sure that you're fine. We're going to take care of you. We're going to which is what my doctor, she was like, I'll take care of you no matter what. Like, she had told me from the beginning, she's like, it's me and you to the end. Like, we're going to get through it no matter what happens. It's me and you. We're a team. And, that was kind of like what I was used to. And so it almost felt like we were I was just like on my own kind of.
Yeah.
And so
Yeah.
it was hard. It was like, again, I don't hold anything against them. It's just, they probably weren't used to dealing with somebody who was like me, which is totally fair because I can't imagine having to deal with me. That would be a lot. And so, in the end, it all worked out. And so I think, and my doctor had even said, the further I think you get out from the time, from what happened, the better it'll be. And it definitely is. As time is progressing, it's definitely getting better. It's further away now. I'm able to kind of like let go of that fear until, if I have another baby, then I guess that we'll have to
Yeah.
cross that bridge then. I don't
Yeah.
know if I will or
Yeah.
not, but we'll see.
Yeah. No, she's young, but she's very wise, because that's really true. You just need time, and you spend time with your son, and he's great. And again, these are long-term things you're dealing with. It's not going to get fixed in a day. It doesn't work like that. And ultimately, the pregnancy did go well, despite the fact it was very difficult for you and is traumatic. And the trauma part you'll have to work through, absolutely. But ultimately, also, you still have a healthy baby, and you got through it, and you'll always know that. And that is helpful.
Yeah, exactly. I mean, he's here and I tell him all the time, I'm like, you know, and people tell me, you spoil your baby because I hold them all the time and I'm very like attentive and very responsive, like to any like little cry or whine. And I'm like, we went through a lot together. Like me and him, we've been through it together. Like right now, like he understands, and so he's here. We're best friends. I stay at home now with him, and so he's my little best friend, and he's definitely was worth every puke, every, bursted blood vessel in my face, every time I like would throw up and pee on myself because of it. You know what I mean? Like
Yeah.
every little moment like that, the lack of sleep, it is what it is. Like I don't really sleep much now because he's, an infant. And I say all the time, this is nothing compared to pregnancy. Like we can do it. I can do anything now. Like if anything, it gave me that motivation and that like belief in myself that like I can handle things. Like maybe I didn't think I could handle anything before, but now I'm like, oh, okay, I'm a little bit tougher than I thought I was. I could totally do it.
It's great. It's a great message to all of us listening. Is there anything else you wanted to give over to any of our listeners?
No, other than, I just hope that if there's even one person out there who's dealing with the same like similar thing that, and like this was something that, my doctor told me too, was like you can always find somebody else if your provider isn't giving you what you feel like you deserve, or if you don't feel like you're being treated the right way, like you can always find somebody else. Like they're there to help you. They are working with you, for you. You feel free to go and try out different ones. You don't have to stick with somebody who is making you uncomfortable. That's something that I found really important because I was really scared that that was what's going to happen with me. And she had told me if at any point you don't agree, we don't see out, you can find somebody else. Please do not, don't feel like you're stuck here. And I know there's got to be people out there who are also scared of doctors and that to know you're definitely not alone, and just be brave enough to find somebody who you mesh with, because they're out there. You guys are out there. You guys, great doctors are there who are patient and kind and understanding, and you just have to look, but they do exist. Absolutely do exist.
Wow. Brianna, thank you so much for volunteering. I mean, you really put yourself out there to talk about your pregnancy and your mental health and, your anxiety and OCD. And a lot of people have a very difficult time talking about that to others and in public. And I think it's great. I mean, obviously someone doesn't want to do that. That's fine too. But I just think it's great that you're not just willing to do it, but you volunteer to do it. And not just, like you said, for your own therapy, because yes, I do think that telling a story is therapeutic, but also to help others who are going through similar circumstances. And there definitely are. And many of them listen to this podcast, and I'm certain that you are helping them. So I really, really do appreciate it. It's not easy to do, but it's a real kindness to tell your story, and so we can all hear it.
And thank you so much. And thank you for, the podcast. Thank you for all the wonderful listening material while I'm up at 3 a.m. But thank you so much for what you do too. I can tell that it's helped. I mean, it's helped me so much hearing all these different people's stories. So I really appreciate it. And thank you for taking time to talk to me.
Thank you for listening to the Healthful Woman podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.